Yes, Sonia, it's Friday. Biba Venus. Hafide, and welcome to the office of the governor, and thanks so much for sharing your energy. We are here today to proclaim October 6th to October 10, 2025 as Primary Care Week. Before we begin, of course, I want to acknowledge the presence of the Honorable Joshua F. Tenorio Segunda Magalahan Guahan, Lieutenant Governor of Guam. Let's give him a round of applause. And he's here all the way from the south because he's a big supporter and a great advocate, Tony Chargalov, Mayor of Inalahan. From the Department of Public Health and Social Services, our Deputy Director, Peter John Camacho. Half a day. Our Chief Public Health Officer, Catherine Encao. Half a day. Dr. Robert Leon Guerrero, Chief Medical Officer, Public Health. Half a day. Former mayor, but here she's wearing her hat as the Guam Community Health Center's Board Chair, Melissa Tavares. Shermalyn Pineda, CEO for the Guam Community Health Centers. Half a day, Ms. Shermalyn. Debbie Paulino, Supervisor for the Guam Community Health Center. Let's keep those applause coming. Rona Santos, Supervisor, Guam Community Health Center. The Lions Club International District Governor, Mr. Ron Hidalgo. And past District Governors, Romy Angel and Feli Angel. With that, though, I have to say, Lions, can I hear you roar? 1, 2, 3. Roar! That's exactly what I wanted. Thank you so much. No rehearsal needed. We didn't practice that. I also want to acknowledge Ms. Michelle Agagi, Associate Director for Guam Cedars. Half a day, Michelle. And Nicole Pineda and Claire Marzan, co-directors for the CHC Volunteers Coalition. Also, I see in the audience Anne-Marie Santos from the Department of Public Health Lab. We're excited to open that lab soon. And one of our external partners, I want to also acknowledge Dr. Thorpe, Medical Director for SDA. Hopefully I didn't miss anybody because I think I introduced most people in the room, but let me know if I missed somebody. I want to give now the floor to Peter John Camacho, our Deputy Director for the Department of Public Health and Social Services, to give his opening remarks. Let's give him a round of applause.
Good afternoon, everyone. On behalf of Teresa Ariola, Director of the Department of Public Health and Social Services, it is my honor to welcome you to today's proclamation signing celebrating Primary Care Week. Primary care is where health begins. It is where families bring their children for their first checkup, where chronic conditions are managed with compassion, and where prevention and wellness take root. At its heart, primary care is about building relationships and trust so that every person, no matter their circumstances, knows they have a place to turn to for their care. It is about helping our people live longer, healthier lives, because when individuals and families are healthy, they're stronger, more resilient, and better able to contribute to their communities. It is about the bigger picture, a stronger Guam. Healthier people mean a stronger workforce, stronger families, and ultimately a stronger economy. Today, we recognize the work of all primary care providers across Guam. Our community health centers, private clinics, and community-based nonprofit health organizations. Each plays an essential role in ensuring that care is accessible, compassionate, and rooted in the needs of our people. Our primary care system on Guam is growing and evolving. Our community health centers, for example, are welcoming new providers, including an internist returning home, and soon an OBGYN, pediatrician, and family physician who will expand access for families across the island. Nonprofit organizations like Todo Guam bring care directly into neighborhoods through innovative models such as mobile clinics, ensuring that even the most vulnerable have access to services. Our partners, the Lions Club, also serves that same mission. And private providers, can never forget the private providers. They continue to anchor care in their communities, serving patients day in and day out with professionalism and dedication. We are also investing in the future. Medical, nursing, and public health students who rotate through our clinics and community programs often choose to return to Guam and serve here. This is how we build our workforce, by connecting that next generation of health professionals to the heart of our community. And while we can share statistics and program updates, it is often the voices of our patients that remind us why this work matters. One parent recently shared after bringing her son for a physical at the Northern Region Community Health Center, "I grew up hearing horror stories about public health and was unsure about taking my son here. But because of time restrictions, it was our only option. The stories were wrong, or at least exaggerated. I've been to many clinics around the world, and Northern Public Health can hold its own with some of the good ones. The ease of navigating the system was better than most. The wait time was great. And from start to finish, it was a wonderful experience. Folks like them need to be commended for a great job, a job well done." This is what Primary Care Week is all about. Recognizing the progress that we've made, celebrating the people and organizations who make it possible, and recommitting ourselves to building on this foundation. Today's proclamation is a reminder that primary care must remain at the center of Guam's health system. It is our collective commitment, government, community health centers, private clinics, nonprofit organizations, and the community itself, to continue strengthening primary care and ensuring that no one is left behind. On behalf of the Director and the Lieutenant Governor, we thank you all for your presence here, the Governor and Lieutenant Governor for their leadership, our partners in the legislature and private sector, Toto Guam and the Lions Club for your service, and most of all, the men and women across Guam's primary care system for your unwavering dedication to the people of our island. Biba Primary Care Week.
Thank you so much, Peter John. I now want to give the floor to the Honorable Josh Tenorio for his remarks.
Happy Friday, everybody. For all the primary care providers and actually the people that support the primary care providers, I think when I was looking at Dr. Thorpe, I was already thinking that he probably knows that when a physician or a physician assistant is in the room with the patient or preparing, there's a whole cluster of people that make their service so much more effective, right? The more supports they have, the more time they have to be with the patients. So the physicians, the PAs, the nurse assistants, the folks that work in all the clinics, in the front desk, back of the house, there is an entire network of people that are providing primary care services to our island's people. And of course, in our island, we recognize that we have folks that are not getting primary care services right now. That's really one of the reasons why we're having this proclamation today, is to really kind of support the efforts that the community has and the responsibility that we all have to trying to get people into primary care. When we have the two community health clinics that are out there in the community in the middle of it all, when we have the nonprofits that are doing outreach that have purchased mobile clinics to go out there and even at least do the first thing, right? Providing children with the examinations that they need in order to register and go to school, right? Even those things, we have parents and families that have barriers, and in some cases, they don't know where to go. And it's because of the outreach efforts of public health and the community health providers, the private sector, and the nonprofit folks. As a community, we go out there and try and bring them into the door. In a diverse island, we also have people that have different belief systems or different experiences. And we know that some people who have migrated to the island or have been born here, but maybe their families migrated, they didn't have access to primary care in the islands of their origin. And in many ways, we have to convince them and educate them in the ways of Western medicine to try and get them in the door so that we can help with the chronic disease problem that we see with the NCDs that we see that are so prevalent in Pacific Islanders and indigenous people that are rapidly, whose health has rapidly been affected by the different diets that have been imposed upon them, or, the conveniences that are not the most healthy. So today, it's our government's opportunity to bring this message out to the people, to recognize everybody that's providing primary care services at all levels, but really to try and get the message out and hopefully to convince people to come out there and open the door to get primary care services. And as you heard the deputy director, there's a group of people that are really working hard to expand the number of providers that are here on Guam. I think that's really one of the things that all of us have an urgency to address, is to make sure that we have great quality physicians that help with our long-standing quality physicians like Dr. LG here and Dr. Thorpe. So on behalf of the governor, who, as you know, has a love of medicine, 2 weeks ago at the Guam Defense Forum, she proclaimed and told all the federal partners that in order for us to have national security, we have to have human health security. And human health security, the front line begins with getting everybody the primary care services they need. Thank you very much, and Viva Primary Care Week.
Thank you so much, LT. I now want to give the microphone to our proclamation reader, former mayor and now Guam Community Health Center board chair, Melissa Savares. Yes, you can give her a round of applause.
I also want to recognize our other two board members, Ray and Rosa and Sonia Naputi Sanchez. Thank you. So this is a proclamation number 2025-96, a proclamation of the governor proclaiming October 6th to October 10th, 2025 as Primary Care Week. Whereas primary care is a foundation of a strong health care system, ensuring access to preventive services, treatment for chronic conditions, and a trusted entry seeking care, and Guam's primary care system is strengthened by the community health centers, private clinics, and nonprofit organizations which work together to serve the people of Guam with compassion. And the providers, nurses, pharmacists, care coordinators, outreach teams, and support staff across Guam's health system demonstrates daily dedication to quality, equity, and community service. And Guam's community health centers continue to expand their capacities with new providers and services, ensuring that residents have access to affordable, accessible, and high-quality care, regardless of background or financial situations. And Total Guam and Seventh-day Adventist Clinic and other nonprofit health organizations provide vital community-based programs supporting the island's primary care system and helping families live healthier lives. And partners with volunteers, students, and training programs are vital to building Guam's health workforce, as rotations in community health centers, hospitals, and nonprofit inspires future providers to return and serve the people of Guam. And patients' voices affirm the progress being made, with families across Guam sharing their positive experiences of accessible, efficient, and compassionate care for their primary care providers. And whereas Primary Care Week is an opportunity to celebrate these achievements, recognize the professionals and organizations who make them possible, and renew our commitment to strengthening primary care for the future.
Now, therefore, I, Joshua F. Tenorio Segundo Magatlahing Guahan, Lieutenant Governor of Guam, hereby, together with Lourdes A. Leon Guerrero Magahagan Guahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim October 6th to October 10th, 2025 as Primary Care Week. I further cause the Great Seal of Guam to be affixed here in the capital village of Hagatna on this third day of October in the year of our Lord, Anno Domini 2025. One more time, Biba Primary Care Week.
Thank you so much, Mayor Savars, and thank you so much, LT. I want to invite everyone in the room to join us in the front for a group photo, and I understand we have Miranda in the back. Thank you so much again.